Hi guys, welcome back to the channel, and today I'm going to be talking about a question I get asked all the time on our DMs and also in our comments, which I find really weird, and that's if studying medicine in Italy is hard. Now, I'm really perplexed by this question every time I'm asked because studying medicine is hard everywhere. Yes, duh, it's going to be hard studying here. However, the system here is a little bit paradoxical where it can be the hardest thing or the easiest thing. I think compared to a lot of other countries, studying medicine here can be incredibly hard or incredibly easy depending on you. Now, before I start this question though, I want to make some quick announcements. The first one is that we're actually launching a podcast, which I think is really exciting. Whenever we did these deep dive interviews with other students, the opinions on them were always really torn. Half of the people thought they were incredibly valuable and wished there were more of them. And even if it wasn't specifically about the university, they wish they could see more of them. And the other half of the people were like, oh, these videos are way too long, we don't care about them. So as a compromise, for the last few weeks, we've been talking about and planning, we're going to be making a podcast about studying medicine in English in Italy, where we interview different students from different universities or even possibly graduates, where we don't have to really care about how long the interviews go on for, or if it's going to do well on YouTube, and so that's our first announcement. And the other one is if when we finally launch it you don't want to miss it, I really recommend that you either follow us on Instagram, because we're going to announce it there, or you can follow us on our newsletter. Again, we don't spam you with anything, it's literally only if there's a big update that we want to let you know about. So with those out of the way, let's get on to the question. Is studying medicine in Italy hard? So when it comes to specifically Italy, I think there are 4 things in particular that make it maybe harder than other countries. The first one always being that all of your exams are going to be oral. Now, I feel like this throws off a lot of students. A lot of students, when they hear this, start freaking out, being like, oh, how are you meant to do oral exams? And of course, there's kind of scary things about this. For example, you have to do it in front of your entire class. Anyone who shows up to the exam day, or even members of the public, can show up and listen to you do your oral exam. And this seems kind of scary. It's also kind of true that you need to know things a lot more in detail. The example that I always give is the biochemistry in Sapienza is on a god tier level of difficulty, where most medical schools, especially outside of Italy, can learn all of the cycles with just the names. We actually have to be able to draw every single molecule from every single step, from every single biochemical pathway. And yes, it is a lot harder. Doing oral exams, until you get used to it, is a lot harder. You don't need to lose hope though. I'm going to explain why. This is really a skill that you can improve in, but usually the argument I see why medical school might be more difficult in Italy is that we have more oral exams. The other reason why medicine might be considered more difficult here is that your grades kind of do matter. A lot of universities all over the world are passing to this pass-fail system, which I think is actually the future, based on all of the research and other things that I'm not going to get into. A lot of universities are switching to a pass-fail system for everything, and in a lot of countries, your grades in medical school don't matter that much. For example, if you are going to be going to, I don't know, America, where you're going to have to sit the step 1 and the step 2, etc., your grades that you get in individual subjects is not going to matter. Your grades, if you stay in Italy, for example, aren't going to matter either, because you have to sit a standardized exam. Sure, if you graduate with a lode on your diploma, you get 1 extra point in the exam, but all in all, it actually doesn't matter that much at all. So why it's actually difficult that your grades kind of matter here is that you're locked out of a lot of things if your average isn't good. So a lot of students want to do Erasmus, which is where you get paid to go abroad and do a semester abroad in a different university in a different country. And this is extremely competitive. It is completely based on not only how many credits you have, but also what your average is. The other thing is, if you want to write your thesis in a more competitive department where they might have a limited number of spots, they're going to check your, what they call your CV, which is basically, again, your average. The other thing is a lot of the scholarships, even the needs-based ones, can be locked behind your grades. So for example, if you want to keep your needs-based scholarships, you might be required to keep your average above a certain amount or have a certain number of credits. And this can kind of be stressful as well. And finally, there is this kind of unspoken system of shame. I feel, I never want to make Italy seem worse than it is, because it's really not. It's really an incredible university and an incredible country, and I'm so thankful that, I get to study there. But I feel like I have to be honest where there is an unspoken like shame about your grades. For example, professors will, they won't give you an 18. They'll give you like a pity 21, but it's under the expectation that you reject your grade. There's been a few exams where like I decided to reject my grade. I can't even remember where, and the professor was like, I think that's a good idea, and like it wasn't even that bad. I think it was like a 24 out of 30. I don't even know why I rejected it in hindsight. Like that was stupid. But anyway, there is this like unspoken system of shame where you're expected to reject your grades below a certain degree. And I've also noticed this a lot when I speak to students where if they get like lower than a certain grade, they start making excuses for it or blaming the professor or the university. Like I don't know how to explain it, but there is a kind of value put to grades here. Now, in my opinion, grades don't matter at all. They shouldn't matter. I don't ask anyone like, oh, what did they get or how did it go? I just ask them, were you happy with your result? Because, one, it's none of my business. Two, it should be no one's business. And yeah, I just think grades shouldn't matter. But the unfortunate thing is like here, grades do kind of matter. Even though they shouldn't, they kind of do. And yeah. The next thing that I think is actually the thing that makes it the most difficult is that the system is kind of built in a way to make sure that you fall behind. Now, this is going to sound counterintuitive, but it is so easy to fall behind in Italy. Like, it's actually kind of rare to graduate on time. Well, I say rare, but the reason why students don't graduate on time is because they have like a scheduling of exam system here. So when you start medicine here, you basically have 7 to 8 dates for each exam that you can choose to sit when you want it, right? You can also reject your grades. So if you get a bad grade and you don't like it, you can reject it and set it on another date. And this in theory sounds great, but it's actually really awful because it means that if you don't feel ready for an exam, you can just not show up. Like if you think that, oh, like I didn't prepare well enough, I'll just try it the next date. But the problem is the next date rolls around and you're kind of like, I still don't kind of feel ready for it. Like, I'm just going to go on the next date. And you keep putting it off for longer and longer and longer, and you fall more and more and more behind. Now, I've talked like a lot about this in detail, but I think this makes it really difficult because there have been times when I know I could pass if I went to the exam, but I choose not to go to the exam because, I don't know why, but you just don't feel ready and you don't go and you fall behind. And it's suddenly, it's the next semester and you still have exams from the previous year and you can't follow what's going on in class because obviously you didn't study for the exams. And then like down the line, there are exams that you can't sit without sitting previous exams. And it just becomes like this absolute mess. And to me, it's just so strange because this could be the most amazing thing in the world, but I think it makes it one of the most difficult things is that, all of the responsibility is on you. Like, no one is going to tell you to do this exam on this date. And I think that's really difficult. I think it's really difficult when you get a bunch of people who are just coming out of high school, usually, or even if it's work, where you're told when you have to go to school, what exams you have to do, when you have to do your homework, all of these things. Or, if you were working before this, where you have to show up to your job and you're given your tasks, to suddenly be given like full reign over your academic career. I don't know. I think maybe it's just me. Maybe it's just me. But I think this really does make the system a lot harder. The final thing that I think makes studying medicine hard here in Italy is when it comes to practical things. Now, this whole myth of, oh, there's no practical work, there's nothing practical, you never get practical experience, this is kind of bullshit. Like, just to say it out straight, it's bullshit. Like, it is hard though, and why it's hard is because no one holds your hand here about things, right? No one schedules all of your practical work for you. No one tells you to go to the hospital. No one tells you to shadow. It is all there for you if you want it, but you have to go and ask for it. So like if you want, you can go into any department you want every single day and shadow a professor. All you have to do is ask the professor, hi professor, can I do this, this, and this? And you can go into the department every single day. There are people in my class who live in the hospital. Like they go in there every single day. They talk to patients, they help out the residents with things, they get like responsibilities, they might even assist in surgery. This is very, very common. You can start doing this in first year if you wanted to. I mean, it's a little bit pointless in first year, but the thing that makes it really hard is that it's not scheduled for you. Like none of it is done for you. You have to be proactive about this. And again, like depending on the type of student you are, this is not that much of a difficulty, but I think it's difficult when you consider all of the other factors into it, right? Because like if you're behind on your exams, it's hard for you to also try and find time to then go into, you know, the wards or find professors to go and shadow. And like, because when you go in there, you're not studying for the exams that you're behind on, or maybe you want to go to, you know, this subject, but you have to pass the exam, but you can't pass the exam because it's locked behind another exam, you know? And the other thing that also I didn't really consider until this year I started going into the departments more is that there's a huge like motivational thing about it, right? Because I was not really missing out on going to the practical experience, but you know, after I went in once or twice to a few different departments, it kind of like I don't know, like it kind of motivated me to see the light at the end of the tunnel. And I think this is really hard, especially when you do your first 2 or 3 years and, you know, it's like preclinical and sure, you go into the hospital 1 or 2 days, but it starts feeling like you're doing this like really heavy science degree instead of medicine. And I think it kind of gets easy to not see the end point where you are going to get to go to the clinics and you are going to get to talk to patients and, you know, you're going to get to meet lots of other doctors. And, you know, to me, like medicine is really fun. Like I love studying medicine because I think it's really fun. And I think going to the departments is really fun. And it's really easy to lose sight of that when you're not regularly scheduled or forced to go in. Now, like I said, in Sapienza, we start going in pretty regularly in in fourth year, we start going in once a week and then basically every single day. And, you know, that's fine to a certain degree, but it really feels like not enough. And like I said, if you are the type of student who will just go and seek out that experience, it's all there for you. You can live in the hospital. You can be there every single day if you want to. But again, this is what makes it hard. Like 1, you kind of have to want to, and 2, you kind of have to chase it. It's not handed to you. And yeah, I think these 4 things make studying medicine here in Italy kind of harder than other countries. Now, I also want to kind of talk about the converse of it though, because all 4 of these things actually, if you are a proactive student and you are a good student and you know, you don't want to be handed everything in life to you, these 4 things will make your life so much easier. And I know this video is going to go on for a while, but like, just hear me out. Starting with the first point of oral exams being harder. Oral exams are kind of harder, but you are rewarded for conceptual understanding, okay? Now, we've all heard like this quote like, oh, if you can't explain it to a 5-year-old, you don't really understand the topic, you know, the Feynman technique where you like have to explain it to someone. And a lot of actually like learning processes and things like that happens when you're trying to categorize information in your head. And this is really important for oral exams, because in a written exam, you just learn the details and, you know, like you can see the question, it kind of prompts you to answer it. But for oral exams, you are rewarded for conceptually understanding things. Like if you can understand and explain a concept, you are rewarded for that. You get higher points for that. And that is the most effective way to learn something. It also helps you remember it for way longer. And the other thing is, once you understand something, you don't really have to memorize it. And you can't really do an oral exam well if you don't understand it. So yeah, oral exams seem kind of difficult, but if you understand the concepts, which is a way nicer way to study and learn anyway, you are super rewarded for this. This is great. And in the future, when you know, like you might have to explain it to another student, or, you know, you're explaining this disease to a patient or something like that, you have gotten all of this practice from all of this time. And that's going to make your life so much easier. Being able to schedule your own exams, sure, is kind of difficult because you have to be motivated and responsible and, you know, stick to a schedule. But man, imagine you stayed on top of all of your exams, you scheduled them all within the first few weeks of June. You're going to get an entire summer off. Okay, that is crazy. I know people who literally did all of their exams in 3rd year in the first 2 weeks of June, which means they got the rest of June, all of July, all of August, and all of September off. They basically got 3.5 months off to just do whatever they want or go into the departments over the summer because they have no subjects, like they have no classes, they have no exams. And like you can literally schedule your entire holidays and life and traveling and, you know, even doing extracurriculars. You can schedule everything. You can have so much freedom. Again, if you're proactive and you schedule your things and do everything like you're meant to. And like when it comes to practical stuff, like sure, it kind of sucks that you have to schedule it yourself, but it really allows you to just focus on what areas you really like. Like I know that in some universities in other countries, you have like mandatory summer practicals where it might be a department that you have absolutely no interest in and yet you still have to waste your entire summer holiday in there. I think it's kind of really nice that if you have a vague idea of what you want to go into, you can super focus down on that. Like For example, let's say I wanted cardio. I did not want cardio. I would never go into cardio. But say I really want cardio and I am like dead set on this. I really don't want to do anything else. I don't need to waste my time, like, spending a month in, I don't know, like neuro or a month in OB-GYN. I can literally just spend all of my free time in cardio. I can write my thesis in the cardio department by showing it up there all the time. I can ask if I can be parts of their research, get my names on like some cardio publications, things like that, which will help me down the line when I want to apply for a residency. I know it's hard to see these things kind of as a positive, but it's true. Like everything that makes studying medicine hard here is also kind of what makes it really great. And I think it's like really all about attitude. Now, the only other thing that I kind of want to talk about, and it does make studying medicine here harder, but it's not because it's like particular to Italy. And I left this to the end because I think if you consider studying medicine abroad anywhere, you're going to be faced with this difficulty. And it's that you're not going to be in like a familiar environment. Now, I think like, when you move out of your house and you get to go experience like independence, blah, 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 that's all great. But when you consider that you're probably going to be in a country where you don't speak the local language, you haven't really met anyone yet, you don't know the bureaucratic processes, these things are things that really weigh on you that you don't expect. Like obviously everyone knows that it's going to be hard when you go to another country and you don't speak the language, but I don't think a lot of people realize just how frustrating it is to try and get something like signed up for the healthcare system, or just trying to go and get your like residency permit and you don't speak the language, and these things weigh on you in a way that I really didn't expect it to. And so I think this really makes it hard studying medicine here. But again, this isn't in Italy. Like if I had decided to go and study medicine in Bulgaria or like Poland, I was still going to have these problems, like I wasn't going to speak the local language. Maybe it wasn't going to be a culture that I was used to. Maybe I'm coming from a lot more open culture compared to somewhere else in Eastern Europe, things like that, like things that I guess I underestimated. I know all of you know it's going to be difficult, but I think we don't really expect how much like language and documents and culture, things like that might really be isolating and difficult. So basically, to wrap it up, is studying medicine in Italy hard? Yes. Is it hard everywhere? Also yes. But also, is it going to be great if you are proactive about it and responsible and you know exactly what to expect and how to prepare and how to plan? Also yes. So I think studying medicine here in Italy, it doesn't have to be hard, If you just survive it, it's not going to be hard. The good news is, though, we actually made a survival guide to medicine in Italy so that once you enroll, you know exactly what to expect, what you can do to hit the ground running, make sure you don't fall behind, and make sure that, you have a really good time here. So if you want to watch that, I recommend that you click here.